Before you accept it's just old age, watch this. Many treatable medical problems can look exactly like dementia, and missing them can cost someone years of clear thinking. What if what you're seeing isn't just getting older, but the beginning of something bigger, and nobody has explained it clearly? Do you or someone you love seem more forgetful, more confused, or just not themselves anymore? I'm a former combat medic, now a board-certified nurse practitioner, and a complementary and alternative medicine fellow. I've worked in environments where decisions had to be made fast, and I now work with families facing slow, painful cognitive decline. Today we're going to talk about dementia in a practical, realistic way, without false hope and without doom. Here's what we'll cover: what dementia actually is, early signs people miss, how dementia is properly diagnosed, conditions that mimic dementia and why, stroke, aphasia and dementia risk, Parkinson's disease and dementia, vascular dementia, Lewy body dementia, Alzheimer's disease, what conventional medicine can and cannot do, and where integrative and alternative approaches may fit. Safely, what dementia actually is. Dementia is not a single disease. It is a general term for a decline in cognitive abilities severe enough to interfere with everyday life. Think of dementia as a syndrome, a collection of symptoms, not a diagnosis by itself. Those symptoms can include problems with memory, language, judgment, attention, reasoning, behavior, or personality. The underlying causes vary widely, and that matters because some causes are treatable, some are modifiable, and some are progressive. Understanding dementia means understanding why the brain is struggling, not just labeling the struggle. Early signs and symptoms. Recognizing early signs is critical. Common symptoms include memory loss, forgetting recently learned information, forgetting important dates, asking the same questions over and over, difficulty with problem solving, managing finances, following recipes, organizing tasks, trouble completing familiar tasks. Things that used to be routine now feel confusing or overwhelming. Language difficulties, trouble finding words, trouble following conversations, disorientation, losing track of dates, seasons, or even one's location, poor judgment, decisions that do not match the person's usual behavior, including neglecting hygiene, mood and personality changes, increased anxiety, confusion, suspicion, irritability, withdrawal from social activities. If these symptoms are persistent and progressive, evaluation matters. A commonly missed issue: hearing loss. Some older adults do not have dementia. They cannot hear. Untreated hearing loss causes social withdrawal, miscommunication, apparent confusion, and irritability. From the outside, it looks like cognitive decline. Hearing loss does not cause dementia, but it accelerates cognitive decline. Every cognitive evaluation should include hearing assessment. How dementia is diagnosed properly. A real dementia evaluation is not a 5-minute visit. It includes multiple steps, cognitive and neuropsychological testing, often performed by a psychologist. This evaluates memory, language, attention, visual spatial skills, and executive function. Brain imaging is commonly ordered, magnetic resonance imaging, or computed tomography to look for strokes, tumors, hydrocephalus, or structural abnormalities. Blood work is critical. We check vitamin B12, we check thyroid function. In selected cases, we test for neurosyphilis. Metabolic issues matter too. Low blood glucose, kidney disease, liver disease. An accurate diagnosis changes everything. Why so many conditions mimic dementia? The brain has a limited number of ways it can fail: memory loss, confusion, poor judgment, personality change. These are final common pathways, not diagnoses. Let's walk through the most important mimics. Depression and anxiety. Depression in older adults often looks different. It may present as apathy, poor concentration, memory complaints, and slowed thinking. This is sometimes called pseudodementia. Depression suppresses frontal and hippocampal activity. Treating it can restore cognition in some patients. Anxiety also impairs attention and memory, and it often coexists with true dementia. Medication effects. This is one of the biggest mimics. Many medications impair cognition in older adults. Sedatives, sleep medications, opioid pain medications, anticholinergic drugs. A medication tolerated at 50 may cause confusion at 75. Medication review is mandatory. Vitamin B12 deficiency. Vitamin B12 is essential for nerve function. Deficiency can cause memory loss, confusion, gait instability, and nerve pain. If caught early, supplementation can help. Thyroid disorders. Low thyroid levels cause slowed thinking, depression, and memory problems. High thyroid levels cause anxiety, irritability, and poor concentration. Correcting thyroid imbalance can improve cognition. Low blood glucose and metabolic disorders. The brain depends on glucose. Low blood glucose causes confusion, agitation, and poor judgment. Electrolyte problems, kidney disease, and liver disease can do the same. Sleep disorders. Sleep is when the brain clears waste and consolidates memory. Sleep apnea deprives the brain of oxygen. Untreated sleep disorders cause memory impairment, executive dysfunction, and daytime confusion. Treating sleep can dramatically help. Infections. In older adults, infections often present as confusion. Urinary tract infections. Pneumonia. Cognition often improves once infection is treated. Stroke and expressive aphasia. Stroke causes sudden interruption of blood flow to the brain. Symptoms depend on location. Stroke can mimic dementia immediately. Expressive aphasia. Expressive aphasia is a language output problem. The person knows what they want to say. They just cannot get the words out. This does not mean loss of intelligence. Language failure makes cognition look impaired. Mislabeling aphasia as dementia is devastating. Stroke as a dementia risk factor. Stroke reduces cognitive reserve. Multiple strokes increase risk of vascular dementia. Parkinson's disease and dementia. Parkinson's disease is not just a movement disorder. It affects movement, mood, sleep, and cognition. Parkinson's disease dementia. This occurs when cognitive decline develops after years of Parkinson motor symptoms. Early features include slowed thinking, attention deficits, and executive dysfunction. Hallucinations are common. Medication balance is critical. Lewy body dementia. Lewy body dementia is often misdiagnosed. Key features include fluctuating cognition, early visual hallucinations, movement symptoms, and REM sleep behavior disorder. Patients are often extremely sensitive to antipsychotic medications. Misdiagnosis can be dangerous. Vascular dementia results from impaired blood flow. Strokes, high blood pressure, diabetes, high cholesterol, smoking. Progression is often stepwise. Executive function is affected early. Vascular dementia is the most modifiable dementia. Alzheimer's disease. Alzheimer's disease is the most common dementia. It involves amyloid plaques and tau tangles. It usually begins with memory loss. Progression is gradual. Medications may stabilize symptoms temporarily. They do not cure the disease. Integrative and supportive therapies. These focus on comfort and quality of life. Art therapy, music therapy, aromatherapy, mindfulness, yoga, tai chi, auricular acupressure, supportive, not curative, supplements and herbs. Huperzine A acts like a drug, never casual. L-theanine supports calm and sleep, does not treat dementia. Phosphatidylserine, small benefit in early decline, 100 to 300 milligrams daily. Ayurvedic herbs, mild support, no cures, use cautiously. Putting it all together. No supplement replaces proper diagnosis. Physical activity, sleep, nutrition, vascular risk control, social connection, appropriate prescription treatment. If something claims to reverse dementia, be skeptical. Final thoughts. Dementia is not just getting older. It is progressive. It is painful. And it affects everyone involved. Focus on dignity. Focus on connection. Focus on quality of life. A person is still a person. Compassion matters.